What's up everyone, welcome back to my channel. In this video today we're going to be talking about all things pediatrics. I just finished my peds rotation and that's what I'm going to be recapping today, so stay tuned. Starting with my schedule, I worked Monday through Friday, no weekends, no Saturday clinic or anything, which was nice. But Monday through Friday, 8:30 to about 5 p.m. Pretty good hours, and fortunately for me, unfortunately for my preceptor, he is having some health issues, so he was in physical therapy twice a week. So honestly, I think it was Mondays and Thursdays, he would leave at 10:30 and we would resume his clinic at 2. So I had about 3 or 4 hours to go home, take Ollie to the park, just kind of hang out, eat lunch at home, and relax. So those were nice days, but overall the hours were pretty easy. The best part about this rotation was probably the patient population. It's probably been my most fun patient population, and that's just hanging out with kids all day. If you don't like kids, your pediatric rotation is probably going to traumatize you, but I get along with kids pretty well. I still feel like a kid at heart, so hanging out with little 5 and 10-year-olds for 8 straight hours didn't really feel like work. It was actually a lot of fun. Another thing that was nice about this rotation is that all of our sick kids were pretty straightforward complaints. So when you're on your peds rotation, a lot of your kids are gonna come in and their chief complaint is gonna be coughing or fever or a sore throat. So you definitely have to know your HENT stuff. So like otitis medias, otitis externas, strep throat versus just run-of-the-mill sore throat caused by a virus. RSV, which actually we didn't see any RSV. We did see a kid who was a follow-up hospital stay for RSV, but for the most part, all of the kids were pretty straightforward when it came to working up a sick patient. There would be times when the chief complaint would be a fever, and I would ask all my questions. I would still not quite know exactly what was causing the kids' issues. The mom would she wouldn't really have a great timeline of when things started to develop. There wouldn't really be any kind of significant fever. So in my mind, I'm thinking more of a viral cause, but then I would take a look at one of their ears and it would be super red, so I would have my diagnosis right there. So that was nice. That saved me quite a few times actually. The other thing that was really nice is that going back to how these patients were pretty straightforward. So we would have some kids who would come in with like a low-grade fever, runny nose, cough, and then have a sore throat. We'd be trying to figure out if they had the flu or if it was strep throat, and questioning the mom. They've been around kids at school who had both the flu and strep, so it's nice to have those rapid tests there in the office, because we would run those 2 tests and it would tell us what our diagnosis was, obviously. And if both were negative, then we knew it was more than likely just a virus causing it, and we would have the patient come back if their symptoms got worse in 3 to 5 days, and that never really happened. I also enjoyed my preceptor on this rotation. He was a little more reserved and to himself, I guess you would say, compared to my other preceptors. But what I admired about him is that he didn't throw me into the like 2-week-old well child checks. He started me at like the 10, 12-year-olds, and I worked my way down. And I think the youngest patient I saw was 8 or 9 months old, maybe 6 months old. But we would work on it week after week. I would feel more confident seeing younger and younger kids, and he would educate me on, you know, what kids are supposed to be doing at any given age, because that's probably the hardest part about this rotation. We'll just jump into that right now. Just knowing your, what they call developmental milestones, and knowing when kids are supposed to be doing the things that they're developmentally able to do. There's a whole book dedicated to developmental milestones, and then I think it's called Bright Futures or something. But I would have a little handout and I'd kind of briefly go over that before seeing a patient, so I knew what to expect. But it is hard when you have a 1-month-old and a 2-month-old and what they're supposed to be doing at that age, because it varies and there's fluctuation, and moms always have a bunch of questions, and I wouldn't always have the answers. I would have to refer to my preceptor, because like I don't necessarily know how long their kids are supposed to be nursing when they're 3 months old versus 6 months versus 18 months, you know? Honestly, I know that if you're 18 months old, you probably shouldn't be nursing anymore, so I would say that's gonna be your most difficult part of this rotation on peds, is the developmental milestones. You can try to prepare for it. You can look up some things about when kids are supposed to be developmentally on track for their age, but you won't really be comfortable with it until you've spent a few years in peds. It's just an exposure thing, and you have to have that exposure, and you have to see those things every single day to feel comfortable telling parents what they should expect from their kid at a certain age. The best way I can tell you to prepare for this rotation is to look over your rashes. So there's a lot of dermatology on this end of rotation exam, and your upper respiratory stuff. You have to know how to diagnose a sore throat and an otitis media or externa, and what the flu is, how to test for those things, what to treat them with, what bugs cause them. And then going back to the derm stuff, the rashes. If you look at your PAEA topic list, you're gonna see that dermatology and HENT are the top two. That's where most of your questions are gonna come from on this exam. So if you could get that down in the first week, then your next 3 weeks or 4 weeks, however long your rotation is, you're gonna feel so much more comfortable, because that's the majority of the complaints that you're gonna see on this rotation. One big piece of advice that I can give you on this rotation is that even though a kid says that they're not having a sore throat, that doesn't mean that they don't have strep throat. Kids will learn that the throat swab that they use to tickle the back of their throat to test for strep really hurts and it's really uncomfortable. So just because a kid is not complaining of a sore throat doesn't mean that they don't have strep. So definitely keep that in the back of your mind. Something to be aware of on this rotation is that moms and dads too, they're gonna ask you some crazy questions, and some of them are first-time parents. So their questions are valid, but you're just gonna look at them and you're not gonna have a clue what to tell them, because you're never gonna even think to have to answer a question like that. So, and most of the time I would give them what I thought was my interpretation of what they were wanting answered, and then I would say, you know, we'll follow up with my preceptor, we'll talk to Dr. So-and-so, and we'll see what he thinks too. So that's probably the best way to go about it. But one of the questions that sticks out to me was a mother was breastfeeding, and she was worried that her kid was not only spitting up, but it was coming out of his nose too, and she didn't know if there was anything like pathological going on. And I reassured her and I said, you know, this could be normal, but if this gets worse, if they stop eating, things along those lines, then it's something to look out for. And my preceptor kind of hinted at the same thing, so I don't know. So that wraps up this video. Like I said, I did have a lot of fun on this rotation. Hanging out with kids, it just doesn't feel like work. And they say the craziest things, they make you laugh, it makes the day go by faster. So that's pretty much it. I hope you guys enjoyed it. Please like and subscribe to my channel if you haven't yet already, and I hope you all have a great day.